So in this comparative analysis of CT and PET assessment within the large prospective GALLIUM study in treatment of follicular lymphoma, we had more than 500 paired baseline and end of induction PET scans. And we identified a highly significant and superior progression-free survival of 87%, 2.5 years after end of induction, in patients who obtained a complete metabolic response with the Lugano 2014 criteria. On the other side of the coin, we only had 54% of patients who failed to achieve a complete metabolic response who were free of progression or death at that 2.5 year time point. But what's also important is that PET scanning, in accordance with the Lugano 2014 criteria, also had a highly significant, superior overall survival in the patients who got complete metabolic response. And 2.5 years after the end of induction, 97% of these patients are alive, compared to only 84% in the patients who failed to get a complete metabolic response. And this 13% difference in overall survival at such an early time point is, a really important and significant result for such an indolent lymphoma. The hazard ratio for death in patients who got a complete metabolic response was only 0.2. So I do believe that this is practice-changing data, that PET is a superior imaging modality to CT scanning for response assessment after first-line treatment of follicular lymphoma. While patients who achieve a complete response by CT have a good progression-free survival, CT doesn't really tell us about the bulk of patients who fail to get a complete anatomic response and their progression-free survival. And CT was not a significant predictor of overall survival. I believe that PET scanning at the end of induction after first-line therapy for follicular lymphoma is now the gold standard imaging modality for response assessment. And furthermore, we can now use this PET scanning as a platform for response adaptive therapy, and also for pooled analysis in combination with other studies to determine whether we can use end of induction PET as a potential surrogate for both progression-free and overall survival.